think it's really important in thinking about the public health system and the future, where we might need to be and how a state health director can help position their organization, is making yourself relevant in the community. What's going on in the community that's important. Of course, at the state level, it would be the whole state. One of the issues, for example, is the big disparities between rural and urban areas. And how can we work with our 100 health departments, or health departments that cover all 100 counties, to truly shore up the capacity there, to bring people together. Even the most rural communities have assets. They have schools, they have faith communities, and some business, they have elected officials. So how do you continue to make yourself relevant as a leader on the issues that are important in that community? As some of it is our time-honored work. If you're working in prevention, you're going to be working on preconceptual health and family planning and making sure that babies are born in the world healthy and wanted and ready to thrive, develop their brains. We know so much now about brain development and focusing on 0 to 3. So it's important for us to stay abreast of the science that's changing and stay focused on the science. It's also important to look for the tables that we need to be at when we're talking about whether it's healthcare or environmental issues or chronic disease, leading causes of death, and all the behavioral changes that go there. Probably understanding more and more about the science of how you actually motivate behavior change would be huge, right? Because we know where lots of health comes from is our own choices. The technology age that's out there, I think trying to stay fresh on just not only the technology advancements around communications and social media and how we do communicate with the public, but also the new technologies around precision medicine and genomics and the possibility of tailoring prevention messages and preventive behaviors to truly to an individual, in a broad population approach, using our phones, using social media and things like that. So I think that we need to build on the lessons that we've learned, like preparedness. We talked about the need for good communications and new partnerships like with law enforcement that we developed, and we have an amazing opportunity now to bring those skills to bear on the crisis of our time, the opioid epidemic. As just one example, it's got the awareness of our elected officials. There's funding there. It's an enormous problem. Everybody's got to be engaged. This is work we know how to do. It can be prevented. It can be treated with training and working closely with our healthcare providers, which are partners that we can refresh that relationship. So, I mean, that's one example of an opportunity that's at hand. But there is the broader picture of being at the tables where important decisions are being made about health and health care, as well as looking long, chronic disease. We've not finished the book of business on tobacco, and we need to do that. I'm very concerned about where we're going with marijuana in this country, another inhalant in people's lungs and the cognitive challenges there. And then early childhood development, a major, major opportunity as we learn more and more about brain development and getting kids ready.